Hi, I'm Dr. Pooja Bhatia Marwaha, Senior Consultant Obstetrician Gynaecologist, Cloud9 Hospital. So आज मैं आपको कुछ PCOS या PCOD के बारे में बताऊंगी. First, let me tell you one story of a patient. She came to me last week, 16-17-year-old girl. उसको 3-4 महीने से कुछ पीरियड्स इरेगुलर हो रहे थे, वेट गेन हो रहा था. उसके फ्रेंड्स उसे उसके फेशियल हेयर्स के लिए चिढ़ाने लगे थे, जिसके बारे में उससे पहले वो थोड़ा अवेयर नहीं थी, बट अब वो बहुत लैक ऑफ कॉन्फिडेंस फील कर रही थी. एंड शी वॉज ऑल्सो फेसिंग acne problem in her back and chest. So now these can be symptoms of PCOD. When she came to me, she was very scared. Actually, she had read many things on ChatGPT and Google, which were partially true but mostly scary for a person who does not know anything about PCOS or PCOD. वो काफ़ी पढ़ाई के लिए stress थी. She was studying for 8 to 10 hours a day, hardly exercising, not getting up from bed even, having a lot of chips and other junk food which was easily orderable by Blinkit and everything, and not sleeping properly. रात को 2-2 बजे तक जागना. She was scared about her acne, her looks. सबसे ज़्यादा उसे डर अपने हेयर फॉल का था कि कहीं वो मेल्स की तरह बॉल्ड ना हो जाए, जैसे कि उसने पढ़ा था. उसे डायबिटीज़ और हाई ब्लड प्रेशर का भी डर था. द फर्स्ट थिंग शी आस्क्ड मी, डॉक्टर, इज इट गोइंग टू स्टे विद मी फॉर एवर? एम आई गोइंग टू गेट बॉल्ड और बिकम अनअट्रैक्टिव और फैट, or I'm going to have acne and beard in my face, or is it going to affect my dating life? She was really panicked. So I calmed her down. I reassured that these symptoms can be managed. They can be controlled by some lifestyle changes and, if required, some medications. So let's first see what is it. What is PCOD? What is PCOS? What is the confusion between the diagnosis PCOD or PCOS? So PCOS is a syndrome. It is a vast syndrome. PCOS का एक पार्ट है जिसमें PCOD का मतलब Polycystic Ovarian Disease होता है. ये टर्मिनोलॉजी हम पहले यूज़ किया करते थे, जिसमें ओवरीज में छोटे छोटे सिस्ट दिखते हैं अल्ट्रासाउंड के ऊपर, जैसे कि पीरियड्स इरेगुलर होना, जो कि एग ना बनने या डिलेड ओवुलेशन के कारण होता है. दूसरी चीज़ हाइपर एंड्रोजेनिज्म, यानी कि एक्सेसिव मेल हार्मोन अपनी बॉडी में, जिसके कारण आपको एक्ने, एक्सेसिव हेयर ग्रोथ इन एबनॉर्मल एरियाज, excessive hair fall in the normal areas just like males, weight gain, etc. हो सकता है. Does everybody who has PCOD require any treatment? Many times I come across patients who come with ultrasound diagnosis of PCOD, but do they have symptoms? Symptoms like delayed periods or having any acne or excessive hair growth? If they don't have any problem, they do not need any treatment, because it is not a disease. That is why we do not say PCOD these days. We say PCOS when it is causing symptoms. At that time, it may require any intervention or management, because PCOD as such does not go away. It can be, there may be some spells in which it is deranged and causing a lot of symptoms, and sometimes when it is just dormant and it does not cause any problem to the patient. Just like that girl who was actually having most of the symptoms of PCOD, one may not have all the symptoms. Some may only come with a history of irregular periods. The others will come only with sudden onset of acne or weight gain. Is this the right time to consult a doctor? Yes. The earlier the diagnosis, the earlier the treatment or the management of the disease can start. So how to diagnose a PCOS? For that, we need a detailed history of the patient and examination. In the history, we ask the patient their lifestyle, any changes in the periods, irregularity in the periods or delayed periods, any history of weight gain, acne, abnormal hair growth. These are all signs of excessive male hormone in the body, which gives us a partial diagnosis of PCOD just by the history. Next comes the examination. If we see abnormal hair growth in different parts of the body like chin, chest and back, acne on face, chin, chest, back, excessive weight gain, high BMI, these gives us the clinical criteria and diagnosis of PCOS. Next we go to certain blood tests, certain laboratories and ultrasound for the final diagnosis. So what is the treatment of PCOD or PCOS? It depends on your symptoms and requirement. If you are visiting the doctor for acne, there are certain topical treatments, there are certain creams that have to be applied on the face, and sometimes some anti-male hormone treatment medications have to be given. For hair loss, there are some certain creams and certain oils that have to be applied, and again certain anti-androgen treatment have to be given. For irregular periods, that is the most common symptom that we come across. For irregular periods, there are certain hormonal treatment that have to be given to the patient, but these treatments are temporary. The mainstay and the long-term treatment of PCOS is the lifestyle modification, and that can be achieved by dietary modification as well as exercise. In the diet, the person must take lot of fruits and salads, that is high fiber diet, the diet with low glycemic index, to increase the insulin sensitivity and decrease the amount of oily, spicy food like chips and outside junk food. For the correct diet, the person must keep themselves very well hydrated, have lot of fruits and salads so that it gives them high fiber, have food with low glycemic index so that their insulin resistance decreases, have good lean proteins, avoid spicy food, oily food, high sugar containing food from outside. They must do right exercise, at least 30 to 40 minutes of regular exercise per day is sufficient to prevent the complication of PCOS throughout your life. This exercise is not just to reduce weight but to maintain a healthy weight and muscle mass as well. Correct exercise also helps us in stress management, so you can do a lot of yoga and meditation as well. Correct sleep is very important part of management of PCOS because it helps us in reducing the stress and the hormonal imbalance also. While the lifestyle and dietary changes are the mainstay or the first line of treatment in PCOS, but we may sometimes have to give certain medications to the patients also. For example, if the patient has too much of hair growth or acne, they may require certain hormonal pills, which are generally the birth control pills also, to treat it. They may require certain anti-androgen pills which decrease the male hormones in the body, and thereby it decreases the male pattern hair loss or male pattern hair growth in the abnormal areas like chin, as well as it decreases the acne. Sometimes the person comes for fertility problems. For those, we have to assist in fertility or give ovulation induction medications. The PCOS patients generally have obesity also. That is basically due to the insulin resistance. So to increase the insulin sensitivity, first the patient has to reduce the weight, do the dietary modifications, and sometimes require a medicine called metformin. Metformin is also used in diabetic patients as it is an oral hypoglycemic agent. It decreases the insulin resistance and helps in certain amount of weight loss as well. In adolescents, we generally do not advise any treatments, any hormonal treatments also, since it is a newer onset disease or disorder. In those cases, it is generally controllable by lifestyle changes as well as dietary modifications only. So just like my patient, I want to give this advice to all the teenagers and the adolescents studying hard for their future, their career, to give importance to their body and health as well. They have to strike a good balance between the right diet, right sleep and right studies. So sleep right, study right, eat right, and exercise right. All the best. So if you have any further queries or questions, you can comment in the comment box, or if you want any personalized opinion for any problems, you can visit my clinic or meet me in the hospital by booking the appointment on the number mentioned here. So if you found this video informative, please like it and share it with someone whom you care about. Since it is my first video on the online platform, I'll definitely make more of these so that it helps the women in need. Please support by subscribing my channel.